I will talk about the next type of vaginal infection leading to inflammation, right? So it's the vagina and also the vulva. So we call this this type is a non-specific vulvovaginitis. So when they say vulvovaginitis is non-specific, what do they actually mean by that sentence? Okay, so this is, vaginitis is inflammation of the vagina. Then vulvitis, okay, that's inflammation of the vulva. So if you have inflammation of the vulva and the vagina, that's what we call the vulvovaginitis. So if it's non-specific, let's describe what it means. So it's actually non-sexually transmitted if we say it's non-specific. Okay, so it's often caused by irritation of imbalance. The specific ones or the common ones are caused by all those human papilloma virus, trichomoniasis, candida, they understand that kind of thing. But anything non-specific, you can't actually clearly identify the infectious agent. So it was maybe due to irritation or imbalance, or the type of cream you are using, do you understand, or the type of clothes you are wearing. So young girls are particularly susceptible to it, okay, because they lack estrogen. Okay, the anus is close to the vulva, so you understand, poor hygiene could now lead to bacterial or irritation crossing over. So symptoms is redness, itching, discomfort, vaginal discharge, pain during urination or wiping. So adult cases is usually caused by maybe we are using very harsh soaps, okay, tight clothing, overuse of intravaginal hygiene products, okay. So some microorganisms may also be implicated, but not the common ones we know. Do you understand? Escherichia coli, streptococcal species. So diagnosis is just clinical examination, vaginal examination, vaginal swabs, okay, and all of that. So that's what we got. So treatment is anything that is actually causing that issue, try to avoid it. So if it's irritant, avoid. Improve on your hygiene. Sometimes if there's inflammation, you can use topical corticosteroids, you can use estrogen creams, and sometimes you are suspecting that maybe there's a bacterial infection but you're not that sure, you can still use antibiotics for that.